Yeah, boy, we seem like maybe we're starting to enter a real golden age of vaccines again, because obviously the success with the mRNA COVID vaccines, we're now seeing that being applied to RSV too, and now possibly Lyme disease as well. Joined now by Dr. Syed Hussain of Trinity Health in New England. Good morning, sir.
Morning, Tim.
Glad to have you here. Yes.
Thank you.
Now, don't want to oversell it, but there is at least a new vaccine trial for Lyme disease moving forward. It's already entered stage 3. I don't know if I want to say already. It might have been a long process. What do we know? Does it look like it might work? Is it too early to tell?
Yeah, this is a Pfizer study, Tim, and there's a local Connecticut connection here with Yale researchers on board, and Stanford Hospital also is a clinical site. It's in phase 3, like you said, which means there's still a ways to go before it gets to the FDA for approval, probably a couple more years at the very least. So we know Lyme disease season happens twice a year, spring and fall. So volunteers in this study will get vaccinated in time for those 2 seasons, get 2 boosters, be observed for a year or 2 to see whether they hold up to this particular disease. Remember, ticks can cause a number of illnesses. This is only towards Lyme disease, but promising nonetheless. We'll see what the results show.
Do we have any reason to believe it could help people who already have Lyme disease, or is this just simply preventative?
No, this is just to prevent.
Okay. All right. Moving on. Actually got a question from a viewer saying this new round of COVID vaccines out here, why is it not being called a booster? Is that even a necessary distinction just for the layperson?
Yeah, I'm glad you asked, because there's a lot of confusion. People want to understand what this is. Is this a booster or not? No. So the booster usually is used, like last year, for instance, in fall of 2022, we had a bivalent COVID-19 booster. What does that mean? It means that it conferred protection against 2 new strains at that time, BA4, BA5, but also against the original coronavirus that started this pandemic in March 2020.
Right.
This new vaccine that was approved by the FDA, recommended by CDC last month, is only active against the Omicron subvariant, XBB.1.5. It has nothing to do with the original coronavirus. So in essence, it's a new vaccine. We do believe it'll be an annual vaccine moving forward. Just like how we reformulate the flu vaccines, Tim. It's not called a booster. It's a new vaccine because it doesn't really confer protection against the previous strains that we saw the prior year.
It's probably just a theoretical question, because the original strain of the coronavirus I don't even think is around and circulates anymore. But I'm curious, is that sort of saying that the viruses are that different? It's changed that much that this new shot would not have protected against the original
So it
coronavirus?
mutates ever so much, and that's why we need to update our, just like the flu vaccine. It probably does confer some degree of protection, but to make sure that the protection is really, strong. And remember, the vaccine premise here for this vaccine is to prevent severe disease, severe illness, complications, hospitalization, and death.
Yes.
Not to prevent mild illness. So even if you get vaccinated, you may still get COVID-19, hopefully a milder version of it rather than any complications. And keep in mind, those that have underlying medical conditions or elderly, those are most at risk for complications.
Now, about this new vaccine, of course, a lot of people interested in getting it. Not everybody is having an easy time getting it. I don't know if it's shipping problems, supply problems. What should people be doing at this point? And should they be considering, do I want to jump in and get it if I'm not in a high-risk group at this point, or maybe wait it out?
Yeah, the rollout has been clunky a little bit, but I would encourage folks to continue either talking to your doctor, see availability at your doctor's office if they are offering the new vaccine, or pharmacies. And we've seen something similar play out with the pediatric age group too. There's a lot of frustration in terms of the vaccine being available widely. So hang tight as vaccine doses continue to get rolled out and shipped to pharmacies and doctor offices nationwide.
Yeah, this is such a simple question, but I have my 6-year-old is going in for his yearly physical in a couple of days. Mine's the week after that. Am I expecting that they're going to offer the COVID shot in those 2 doctors' visits? Yeah,
you need to ask your child's pediatrician, call their office to see whether they're offering it. If not, then there are other avenues where children, depending on age, Tim, can get the vaccine.
Sure, CVS's and Walgreens are everywhere. Those are the places to go. Doctor, thank you so much for joining us.
Thanks so much.
As he always does, love to get his knowledge, guys. I'll send it back over to you.